This is Curious Television, a professional online-based television committed to promoting truth, balanced and objective reportage without fear. Please like, share and subscribe to our YouTube and Facebook channels. Curious Television, fearless pursuit of truth.
In a bid to tackle reproductive and adolescent health challenges in Nigeria, the European Union ambassador to Nigeria, Gilta Mignot, says 3 of Kwara, Adamawa and Sokoto have been selected as piloting states to assess €40 million fund by the European Union to further address and strengthen access to reproductive and adolescent health challenges in Nigeria. Mignot, who was represented by the Program Manager for Health and Nutrition of the Union, Ayeke Anthony, disclosed this in Ilorin, the Kwara State capital, during the steering committee review meeting to assess the progress made so far on the EU-funded projects in the selected states. Members of the steering committee of the European Union Strengthening Access to Reproductive and Adolescent Health Program (EU-SERA) are in Ilorin, the Kwara State capital, to verify the level of progress made so far. European Union Ambassador to Nigeria, Gilta Mignot, said the project consists 3 major components, which include policy, adolescent issues, including other issues which border on access to data to aid project implementation.
We call it the SERA project, which actually means strengthening access to reproductive health in adolescents. We have it in 3 states, Kwara, Adamawa and Sokoto. Yeah, those are the 3 states, and it has 3 components. The first part looks at policy issues around adolescents. The second part looks at access issues that especially bedevil adolescents, and the third part is on data. So we're here, it's a steering committee meeting, but also opportunity to look at what's happening in the field, and I must say that we're very impressed with what has happened so far. In terms of the financial outlay, the project is being implemented by UNICEF and UNFPA, and it's €40 million. Going forward, I expect that it will not just be like other projects, it will be an integrated approach. It will be health for the money and not just money for health, and then it's also going to be very comprehensive, and there will be sustainability.
Money is that these 3 states are pilot states, and then when this is done, it's a full package that is being provided in these 3 states, and when this is done, we assess if the health indicators crash down maximally in these 3 states. Wow, every other state in the country will emulate, and then the government will scale it up. And ownership time. Area is there, and that one has been discussed at the steering committee level and already addressed, and the EU are doing it based on maybe what indicators and population and a host of other factors that I will not list now because of time.
This program was very important for us as a steering committee review, because we really are looking at how we can improve, how far we've gone with implementation, what we can learn, and how to improve implementation, especially because we're looking at young adults, adolescent girls and boys. We really want to see how to make sure that they've got information and services which are related to sexual reproductive health and rights. We also don't want women to die whilst giving life, so we're also making sure that there's family planning, commodities, and also that health workers are trained to save the lives of moms. We saw this morning some big testimonies which are so heartwarming. With the recent training that has gone on, there were actually some results and very wonderful stories. So
European Union, United Nations Children's Fund and other implementing partners who went round most of the public health facilities maintained that Kwara State has implemented most of the stems that are within the EU-SERA projects.
Assessment at this time, you know, it's a snapshot, but I think it has been very impressive. We've been to the primary healthcare facilities. We've seen some of the basic emergency obstetric health services that are provided, and here we've seen the comprehensive services provided.
Kwara have actually implemented most of the stems that are within the EU-SERA project, and that's why we are here. So we are here with other states so that they can learn and share experiences from the good way Kwara has implemented this project in country, and what we have seen actually baffles us, and wow.
Kwara State is a state that has consistently punched above her weight in health. We are low in terms of our federal allocation, we are low in terms of IGR compared to some other states. So that is one factor. But despite our funds are limited, if you see our health indicators, you would think we earn more than that. So what partners and investors and collaborators want to see is willpower, political will, the desire to improve things. And as you all know, Malam Abdurrahman Abdurrazak, the governor of Kwara State and chairman of the Nigerian Governors Forum, has been consistent in his dedication and support for health.
I am thrilled. It is so encouraging, exciting to see that the progress which all 3 states have made so far. And also we visited health facilities here in Kwara State. It is beyond the words to say that how effective they have done their implementation, and we heard from mothers as well, the ones who are really taking benefits of the program, and also from our youth, the adolescents, that they're really benefiting from the investments in the state.
The European Union Strengthening Access to Reproductive and Adolescent Health EU SERA program is a collaborative effort between the EU, the federal government of Nigeria, and the key partners like the UNFPA and UNICEF.
This is Curious Television, a professional online-based television committed to promoting truth, balanced and objective reportage without fear. Please like, share and subscribe to our YouTube and Facebook channels. Curious Television, fearless pursuit of truth.